Alright, so I'm actually wanting to talk to you guys about vital signs and why they are important, what the numbers mean, and whether it can actually determine your overall health. I've been a CNA for 10 years, so I've been doing my fair share of vitals. I've been doing them every 4 hours for my entire career, and I know that sounds ridiculous, and even at the very beginning I used to think, oh my gosh, does someone really need to have their vitals checked every 4 hours? The answer is yes, they do, because if they're in the hospital setting, for example, it can actually really tell someone a lot about whether their vitals are changing from a low blood pressure to a high blood pressure, or if their temperature has changed from a basic 98.6 to 103. That could actually tell us a lot. Maybe they've gone septic, or maybe they're in a lot of pain and we need to get them pain medication. So vital signs are vital and they can save someone's life. Knowing your vital signs for yourself is actually really important, just because it can help you know whether maybe you need to change your diet or exercise more. Maybe you just need to manage your stress levels. So we're going to talk about those today. What are vital signs? Vital signs are blood pressure, pulse, oxygen level, respirations, and temperature. This lovely picture here, you might see, if you go to see a doctor, you might see a lovely little nurse's aide roll in with what we call dyno map, and that's going to check your temperature and blood pressure and things like that. But the important part is knowing what those numbers are and what they actually mean, or for you to know as well. So understanding the blood pressure levels. Hypertension. Hypertension is going to be the 140 over 90. 140 is the systolic, 90 is the diastolic. Pre-hypertension is also important though, because that means you're on the road towards hypertension, and those levels are 120 to 139 systolic, that being the top number, and 80 to 89 being the diastolic number. 120 to over 80 is the normal range. Granted, of course, you could be 122 over 82, and guess what? You're now pre-hypertension, so pay attention to that. But 120 over 80 and anything under that is good. However, there is such thing as too low of blood pressure. So if it gets to under 90 systolic and under 50 diastolic, you're actually in a really low blood pressure range, and you should probably go see your doctor right away and see what's going on. Now, obviously, the question is, what is systolic and what does diastolic mean? The top number is referring to the amount of pressure in your arteries during contraction of your heart muscle, and this is called systolic. The bottom number refers to the blood pressure when your heart muscle is beating, and this is called the diastolic pressure. Now, of course, I'm going to give you some statistics, because knowing your blood pressure is actually important for many reasons. 1 in 3 adults actually has high blood pressure, and that's in the US, so 67 million people. About 36 million adults with high blood pressure don't have it under control, which is why knowing it can help you keep it under control. Whether that means, again, diet, exercise, or stress levels, or just seeing your doctor for medication. High blood pressure is a major risk factor because it is a leading cause for heart disease and stroke, and those are problems in the US for death. Now, of course, high blood pressure contributes to 1,000 deaths a day in the US. Now, of course, going back to what vital signs are, pulse. Pulse is also a vital sign. How do you check your pulse? Well, of course, on the Dynamap, they actually have a cute little machine that'll do it for you, but if you need to check it manually, the best place to do it's going to be on your wrist. It's going to take your pointer finger, your middle finger, and pressing it firmly on your wrist, shown in this picture here. There are, like I said, other places that you can check it, but the best place for you to check it on yourself is going to be on your wrist. You should count for 60 seconds on yourself, and as you count for 60 seconds, you will, by the time you get to the end of it, that is what your pulse is per minute. Now, you should get 60 to 100 beats per minute, and that's at a resting heart rate. So if you're exercising, your heart rate is obviously going to be elevated from that. And if you're sick, and it can also be lower than that. Now, your oxygen level, that is when you're going to need one of those fancy little pulse oximeters that we see in the doctor's office. And that goes on your finger. This will show you not only your pulse rate, but also your oxygen level. That needs to be 90% or higher. We'd like it to be between 90 and 100% in Colorado, and that's just because of the high elevation. Other states, it's 95 and higher, but they don't have our elevation, so welcome to Colorado. Next is going to be respirations. That's going to be the amount of breaths you take per minute. So when someone is watching your respirations, it's the breathing in, watching your heart or your chest level rise and go back down. So as that happens, it's harder to watch that on yourself, so you're not going to sit there and take multiple breaths and count that because, well, you're going to be probably breathing more often than you need to or counting more than you need to. So maybe ask someone else to watch that, but not when you're paying attention. And then lastly is going to be your temperature. Your temperature is important because if you have a fever, obviously you want to see a doctor or someone, but there's many different ways to take your temperature, and that can be orally, rectally, axillary, ear probe, or temporally. Now, how these thermometers are used is also important because an oral thermometer needs to go under your tongue and wait till it beeps or has been in there for 2 minutes, depending on if you're using an old one or a new digital version. Now, a rectal thermometer is also the exact same thing as an oral thermometer, just hopefully well cleaned first. Now that's just going to go in the bottom, but the temperature is going to vary 0.5 to 0.7 degrees higher than your oral temperature, and that is the most accurate, especially for babies, so that's often when it's used. Then there's the axillary temperature, as we can see back here. The child has it perfectly underneath the armpit. Now that's going to run 0.3 to 0.4 degrees lower than the oral temperature. Then there's the ear temperature, which is really good for toddlers because it's a quick temperature that's checking your eardrum, and the eardrum will give you a quick temperature that way. And then there's temporal, which is the version that they go across the forehead and under the ear, and that checks the skin temperature, which is really good for doctors and hospitals to use because they can afford a really fancy, expensive thermometer. Now again, the fever, or whether it's not a fever, is kind of a big deal. 98.6 is your normal temperature. 1 degree higher than that is actually considered a fever. However, it doesn't mean you need to take Tylenol or Motrin right away. Fevers are actually a good thing, and they're important for the body. This is important for the body because a fever is your body's natural way of fighting infection. And if that's happening, then we don't necessarily want to treat it right away. You may want to let the body fight the infection naturally. Now, if you get uncomfortable or it gets too high, then you're going to want to treat it. And if it gets too high, and we typically say 105 to 106 is too high, you want to consult your physician right away for help. Now, there is the other extent of this, and that's hypothermia, and that's any temperature that drops below 95 degrees. So, are vital signs vital? Absolutely. Because if you monitor your own vital signs, then you can do this pretty much at any place like King Supers or so forth. You can go in and have your stick your arm through one of those little fancy holes. Blood pressure will get checked, and those machines will check it there. Now, knowing whether you have hypertension or not is a good deal. So if you check it, you find out you have these numbers, and you know what the number is, you can figure out what you need to do. You may help manage that. Now I'd like to end on a happy note. So being in control of your life and having realistic expectations about your day-to-day challenges are key to stress management, which is perhaps the most important ingredient to living a happy, healthy, and rewarding life. And that was said by Mary Lou Henner. Thank you very much, guys.